Hey, welcome to another episode of the Go-To Physio podcast. My name is Dave O'Sullivan, and today's episode, it's a shorter, sharper segment where I want to give you one key thing to think about so that you can get on that road to building a go-to clinic that delivers you your definition of success, whatever that might be specific to you, how you want to feel on a daily basis. But most importantly of all, we want that to happen while the clinic continues to grow without you, essentially, so that you can treat patients on your terms. Now, today's episode topic is all about embracing a value-based outcomes culture. Now, why I've decided to start with this for one of the more smaller segments is because one of the big frustrations you are probably running into if you're a multi-therapist clinic owner or if you're about to hire your first staff is when you give your therapists a case full of a diary full of patients, and lo and behold, 2-3 weeks later, a lot of those patients have dropped off again. And from coaching a lot of therapists, I know one thing that they struggle and get frustrated with on a daily basis is coaching therapists to keep patients progressing. And there's a whole host of issues that are hardwired into us as therapists that's beyond the scope of this practice that we need to get to the bottom of. And that's something that we do comprehensively. We talk you through in the head physio systems in the Go-To Clinic Mastermind. But there's one thing that you can do today that's going to really help you as a clinic owner, and that is embracing a value-based outcomes culture. Now, creating a culture takes time. So that's why I wanted to do this short segment today, is to get you on that road straight away. Okay. It's a bit like the best time to plant a tree was probably thousands of years ago. The second best time is today. And it's the same concept here today. Okay. Now, we all know the importance of outcomes, okay, patient outcomes. But I think one of the biggest things that therapists focus too much on is internal outcomes specific to the patient's pain, range of motion, strength, and all of those good things. Okay. Now, I'm not saying for 1 second that they're not important. Of course, they're important for us. But information without context can be a lot less valuable, essentially. So, what I mean by value-based outcomes culture is tending to prioritize the outcomes that the patient wants. So we as therapists tend to prioritize, okay, we want to regain strength left v right or within 90% of it. We want full range of motion, all of these good outcomes. The problem is there's a mismatch in communication with patients. So when we go and look at a value-based outcomes culture, that is very much around, first and foremost, getting clear on how a patient defines value. Okay. And that is the first step to creating consistent results, raving fans, referrals, and reviews. And this is going to do a lot of the heavy lifting for you when you're managing your therapists later on your journey towards getting freedom. So the first thing we need to establish, and this is where this needs to be top of mind for your therapist. And that's what I mean when I go back to embracing a value-based outcomes culture, is this is at the tip of the tongue for both your therapist, but also your admin team, anyone answering the phone, anyone who comes in contact with your patients on a daily basis. So perceived value is the expectations that the customer has from your solution. Now, we've had this in our clinic this week again, where we had an unhappy patient. And again, an unhappy patient is an opportunity, okay, if you learn your lessons. Okay. So again, although initially I don't like getting them, there's always this saying, this happened for us, not to us. Okay. And again, the more I'm looking at this and the more I'm understanding the value-based culture now, it's clear to see that it's a lack of clarity on what the patient was expecting is actually the root problem to be solved. It's the root problem to be solved in probably 90%, 99% of unhappy patients. Now, that's a big statement. It's a lack of understanding of what the patient was expecting and managing that expectation. It's very often not clinical skills or other things like we might be led to believe. So perceived value is the expectations that the patient has from our solution. And then actual value is only created when the expectation is matched. So this particular patient was looking for something specific that didn't happen. They came in with an expectation of what they were expecting. They didn't get what they were expecting. Okay. Now that's not to say that what they received wasn't necessarily the wrong thing. Okay. But the specific things that they were expecting didn't happen in that scenario. Okay. And this is the tricky bit as a clinic owner is you have to get that balance right. Okay. Where, yeah, we have to appreciate the patient's point of view, but we also have to protect the confidence of the therapist because as such, they didn't do too much wrong, but there's just a couple of things that they didn't do that was a higher priority for the patient. And this is where when you start to understand this, you can really take it to the next level in terms of patient experience also. Okay. So actual value is only created when the expectation is matched. Okay. So for all intensive purposes, that therapist was believing that they delivered value. And from my point of view, of course, they delivered value to the patient, but the patient didn't feel the value because they didn't get what they were expecting. Again, this is where this is so important. It's all about the perceived value, not the actual value, because unless they've perceived the value, then essentially no value has been delivered. And that's quite harsh, and it can be quite hard to take for us as clinic owners and clinicians, but unfortunately it's the truth. Okay. So Raven fans, referrals and reviews are created when the solution exceeds the expectations of the patient. Okay. So when we go above and beyond that, now that should fill you with confidence because now this whole concept of Raven fans, referrals and reviews, it's demystified. So all we need to do on a very simple process is to go step one, understand how the patient defines value. Step two, deliver that value. Step three, exceed that value. Okay. Now, obviously, a very, very simplistic overview of it. Okay. It's simple to understand, not so easy to implement. Okay. So some of the key things to understand with the value with the patient is that a lot of the times, we as therapists are focused on the external motivators like the back pain and everything got to do with the back pain. Whereas the true value for the patient is asking them the questions, what's the pain stopping you from doing? How it's affecting your daily life? What's the defining moment when you decided to take action and get this sorted? Is your pain affecting anything else in your life or anyone else in your life? And it's starting to ask these questions. And even if your therapists are asking these questions, and you're still getting a lot of issues where patients are dropping off or they're being discharged after 2 sessions, it probably highlights that the value that the therapist is giving to these questions, okay? Because these questions on the left are the most important questions in order to elicit the internal motivators for the patient, because these internal motivators are giving you a big clue into how the patient defines value, okay? Now, the answer to these questions of what's the pain stopping you from doing, how it's affecting your daily life, what was the defining moment for when you came to see us, is the pain affecting anyone else? These are the outcomes by which the patient defines value. Okay. Whereas a lot of times on the right hand side, this is what the therapists think the patient defines value when we improve range of motion, when we decrease their pain to a point. Okay. We can decrease their pain, but if they still can't do the things on the left hand side of what the pain's stopping them from doing or how it's affecting their daily life, then that's all well and good to a point, but we haven't actually given them what they expected because these are the things that they're coming for. Okay. Now, the big problem, and I've spoke about this before, is we've been conditioned to focus on pain, muscles, pathology for 3+ years in university. We think we speak in terms of pain, muscles, pathology, but our patients think and speak in terms of value or outcomes. So it's the outcomes that are most important. So we must condition ourselves to think and speak in terms of patient outcomes, and we have to embrace that culture. And again, when we do that, it gives us as head physios and clinic owners an instant snapshot of how the patient defines values. Okay, so this is our patient storyboard that we use in the Go-To Therapist Mentorship in the Go-To Clinic, where instantaneously I can see on the right hand side here how the patient defines value. They want to be able to sleep, stand on their leg, get up from sitting pain-free. They want to walk, do the stairs and run. I can instantly see in a snapshot when I look at that how the patient defines value. But also I can instantly see if that value is quite vague, what's not, or what maybe my therapist, how they struggled. I'll say that again. Sorry, coming up fumbled my words there. What I can also see is if my therapist hasn't been able to extract how my patient defines value or how that patient defines value. So that's really important to understand as well, is it's not just about for you as a clinic owner seeing, okay, this is the outcomes the patient wants to achieve. It's also a really useful tool for you to get an insight into how top of mind this is for your clinicians. And outcomes are undeniable proof that the patient has received value if we tick these outcomes off. Okay, so again, for us now, the patient is responsible for giving permission to tick these outcomes off. Are you now able to sleep completely pain-free? Are you able to get up sitting from standing pain-free? Are you able to walk pain-free? Are you able to do the stairs pain-free? Are you able to achieve your definition of success pain-free? And outcomes are a yes or a no answer. And that's the beauty of these, is it takes away a lot of the ambiguity. Okay. Well, it's my opinion that the patient's made progress and they're ready to discharge, says your therapist. You say, okay, have you undeniable proof that that patient can sleep pain-free? Have they achieved that yet? Have they achieved this, this, and this? And it's a yes or a no answer. And if they haven't achieved this yet, then why are they being discharged? Okay, so it makes a lot of the management of your therapist a lot easier. Now, the other thing that I really like about this as well is it takes away this whole thing around a clinical opinion, okay? Because the beauty of our profession is there's more than one way to get to the same outcome. So it doesn't matter if the therapist treating the patient treats differently to you. That doesn't matter. What matters is that they achieve the outcome. And you know, if they're achieving the outcomes with the patient, then the patient is receiving value, okay? And if they're not achieving the outcomes with that clinical approach, then maybe you want to upskill them or maybe take other action, okay? And again, in the Go-To clinic system, your therapists have access to the Go-To therapist mentorship. And we've really doubled down on this now, and we've developed a software for clinic owners so that your therapists can get hyper focused on these outcomes. So if you want to sleep pain free, then that's the outcome. Then we've got all of the assessments that you need to assess to do that. And then we've got all the hands-on techniques that are going to help your patient to do that. And then we've also got the rehab exercises that you can give patients to achieve that. So all we need your therapist to do essentially is to extract the outcomes from the patient, and then our Go-To Clinic software, which is just about to be released to our Go-To Clinic Mastermind members shortly, it does a lot of the heavy lifting from a clinical point of view. So if your therapists are even new grads, all they need to get really good at is the subjective assessment, rule out red flags, extract the value from the patient, and then the clinical skills in order to achieve them, they can be taught very, very quickly, and we can give you every shortcut. And it also makes it clear that there's more work to be done, even when the pain eases for both the patient and the therapist. And it helps us manage these therapists, as I said, discharging patients too early, because it's a yes or no question. Have they achieved this? Yes or no? So it holds our therapists accountable, and it holds us as a clinic accountable as well. Okay. So delivering value, we want to know the expectations of the patient. We do that through the subjective assessment. We want to know the outcomes that the patient defines value as, and they need to be recorded in the notes or in the storyboard that we use in the mentorship, whatever way you want to record that. But you should be able to audit any therapist notes, and in literally less than 60 seconds, you should be able to go and find how that patient defines value. Okay, because that's truly all that matters. Then we need to analyze how to give value, which is in the objective assessment. So again, in the objective assessment notes, is the therapist going through the motions, or are they actually assessing how the patient is currently sleeping? Are they assessing how the patient's currently sitting the stand? Are they assessing how the patient's currently walking? Because if they're not making it specific into the context of how they define value, then we're at a big, big risk of delivering value, but it's not being perceived by the patient. Because remember, no value is being delivered unless it's being perceived as valuable by the patient. And then we need to set expectations after the objective assessment. So if it's going to take a little bit of time to get there, we need to say that. We need to set expectations. Okay. And again, that's the thing with the unhappy patient in our clinic. The expectations weren't set. They were looking for something that didn't happen in that session. And if the therapist couldn't give it in that session, that's fine. But they need to set expectations as to why they can't give it in that session. And that's the thing that didn't happen in the session, which caused the patient to be unhappy and feel like they didn't get value, even though from our point of view and the therapist's point of view, he was delivering a lot of value. And this is where it gets very, very tricky and frustrating. But once you understand actually that it's all that matters is how the patient perceives value, then it gets a lot easier, okay? And then we need to find the issues, and we need to start fast so the patients can feel the difference in the outcomes defined. So again, they need to feel the difference in the treatment. And that's the beauty then of understanding how to define the outcomes, is because we can then start to optimize our treatment towards these outcomes. So again, that's where the system becomes so important. Is it's a set of independent frameworks where all of the hands-on techniques and the rehab techniques that we have in the Go-To Clinic hub, it is for your therapist, it all is streamlined towards achieving that outcome in the context of the outcome for the patient. So that's the key things. The big thing to take away from this podcast and the next action that I want you to do is I want you to reflect on how good out of 10 are you at the moment of adopting a value-based outcome culture for your clinic. Do you talk about it on a daily basis? Are your notes templates set up for it? Are your treatment and clinical systems set up for it? Okay. Are your head physio systems set up for it? Okay, and where is there work to be done? Okay. Now again, culture will take a little bit of time, but the best time to start is today. And if you can get this installed, it's going to give you a lot of confidence then, so that you know that no matter what patient is coming in, you've now got a way to see how they're perceiving the value, but most importantly, you've also got a way to be clear on if your therapist is perceiving that value also. Okay, and then we can have conversations, and then the in-service trainings can be a lot higher quality, because now what we're doing is we're optimizing for outcomes for patients rather than just treating another clinical technique without the context of the outcome. Because without the context of the outcome, no matter what you're delivering to the patient, if they're not perceiving that value, then essentially no value is being delivered, whether that's fair or not. Okay, it's the reality of the situation. Okay, so I hope that's useful. Go and reflect on that this week. If you want some shortcuts, implementing all of this and the systems, the structures, the notes, templates, and then most importantly of all, access to our new Go-To Clinic hub, which is a training resource for your therapists that is 100% focused on achieving outcomes. So whether it's a patient who wants to go and sit for 5 hours a day, we have all the assessments you need, we have all the hands-on techniques, we have all the rehab techniques that you need essentially to achieve that from a biopsychosocial approach. Okay, so again, it mightn't just be the hands-on techniques. You might need to do some breathing stuff. You might need to do some belief work with them as well. But essentially, we've got everything there you need to help your therapists if they're struggling to achieve the outcomes. Okay, and again, that's the beauty of the outcomes, is there's no right or wrong way to achieve the outcomes, but there's an optimized way. Okay, and that's what we want to do in the Go-To Clinic Hub, is to give you and your team everything you need to deliver these values time and time again. Okay, so that's it for today. Hope you enjoyed this clip. Go now, spend some time, reflect on it, and don't try to overhaul everything tomorrow, okay? But I just want you to start to think about this now and start to think about implementing this, okay, with your team and what's the best way to do it. And then I'll see you in the next few episodes where we'll build on this episode. Okay, that's it for me from today. I'll see you on the next Go-To Physio podcast, where we help you build a go-to clinic that gives you happy patients, happy staff, high profits, and freedom for you, where you can reclaim your time with your family, but also your personal health as well. And I think that's a big thing, as well as you as a clinician. A lot of the times we help a lot of people, but we don't prioritize our own personal health. Okay, so that's it for this week. Or today, I'm going to do a lot more of these during the week, so I have to get out of the habit of saying that's it for this week. That's it for today. I'll see you on the next podcast. Thanks for tuning in to this week's show. I hope you enjoyed it. Now, if you'd like a free copy of my Head Physio Systems 6-step checklist that I use to personally audit my own therapists to make sure that they can keep patients progressing even when the pain is eased, so that we can ethically increase our patient numbers, our revenues and referrals, head over to www.thegotophysio.com/checklist and I'll get that sent straight over to you. That's it for this week. I'll see you in next week's show.